Now, the desire to have beautiful colored eyes has probably been an enduring phenomenon amongst people for, well, forever. So when a mini trend started a few years ago that involved getting your eyes permanently changed in color via eye color surgery, then this must have been a dream come true for some. But for many others, that dream quickly turned into a nightmare, with some losing their sight and others having to endure permanent damage as well. In this video, I'll explain some of the dangers of this procedure, and if you're in a rush and just want a professional opinion on whether you should consider having this procedure done, then here it is. Just don't. Hi and welcome to the channel. I'm Martin Aguzzi and this is Martin's Eye Tips. Thank you for joining me. At this channel, we're all about helping you to see better, see more comfortably, and to be less anxious about your eyes. Please go ahead and hit that subscribe button and the notification bell as well if you do. That way you get reminded every time I release a new video. So if you've only had a passing interest in changing your eye colors, or maybe you are satisfied with contact lenses that do the same job, then you probably won't be aware that this procedure even exists. And if you are somebody who lives in a country such as the United Kingdom or in the United States, then this procedure won't even be an option to you because it's not approved for safe use. So the procedure involves inserting a silicone-based lens of your desired color into the anterior chamber of the eye, and it's rested onto the iris of the eyes. Now, while it can produce a more convincing looking eye color, the risk to sight long term can be huge. And just a quick look on the internet for eye color surgery before and after. These results will show up videos highlighting stories of people who've had to endure damage to their sight, who've had to go through reversal surgery, and maybe even develop glaucoma and so on. So suffice it to say that I think that the risks make it not worth taking, despite any evidence or testimonial videos that you might come across saying otherwise and promoting the benefits of this procedure. So people having these procedures may also have to travel, depending what country you're in, to have these procedures done, and that might then present you with kind of some issues with then having a procedure done in a different country and then coming back to your own country where the procedure may not be available, and then you may have problems getting experts to be able to offer you any aftercare for the procedure that you've already had done. And on top of that, these procedures often cost more than approved procedures that people often perceive as being quite expensive, such as LASIK surgery. So why is eye color surgery so bad, I hear you ask? Well, let's get into that right now. So here are just 3 reasons that I think that eye color surgery can be dangerous to your sight. First of all is secondary glaucoma. So glaucoma is a condition where the internal pressure in the eyeball becomes too high, and this can gradually over time cause the sensory cells that make up the retina to start to die off, and you lose sight as a result. There's lots of different causes for glaucoma, but one of them can be a blockage that stops the drainage of fluid in the anterior chamber out of the eye. So this fluid is produced in the posterior chamber in the eye by the ciliary processes, and it drains out via a drainage meshwork in the corner angle between the cornea and the iris. So when you have these colored lenses resting right against your iris, they can rub against it as your pupils dilate and as they constrict, resulting in abnormal shedding of the iris pigment. These pigments may get carried into the drainage meshwork, causing them to get clogged up and blocked. As a result of this, eye pressure then starts to rise, leading to glaucoma. And I also imagine that the silicone lenses themselves can become an obstruction to drainage because they have to be so large in order to cover your natural eye color. So this type of glaucoma is called secondary glaucoma, and in this case it's secondary to the implant itself effectively. So the result of having glaucoma could mean that you might then have to take eye drops for life in order to get the pressure down, or you may need a surgical procedure to improve drainage of a fluid in the anterior chamber. So let me know in the comment section whether you feel that that risk is worth taking. The second reason is iris inflammation. Now, the consistent rubbing of the iris by this colored lens can cause irritation of the iris, and that starts off an inflammatory chain reaction that can lead to a complete loss of sight effectively. So inflammation of the iris is called iritis, and in this case it would be caused by the trauma of being irritated by this lens that's sat directly in front and possibly right against the iris itself. Now, iritis can have different causes, but it can be a very serious condition and it can get serious very quickly. It can lead to debris or floaters floating within the eye. It can lead to pain, glare, and it can lead to potentially sight loss as well. Now, anybody who's had regular iritis will know how painful that can be. If you're one of those people, let me know in the comment section below what advice you would be giving anybody who's thinking about having this procedure and might have the risk of iritis as one of the complications. And thirdly is visual disturbances. Now, imagine that you may experience some problems due to the fact that this new iris color that you've got also creates a smaller fixed pupil for you than you would normally have. If you're a young person and you normally have quite large pupils, then your pupils are going to be limited now by this artificial hole in the middle of the colored lens that's created. And that can be an issue because it can mean that your pupils in situations where they would normally be large, such as in dark situations, so if you step into a dark room, for example, your pupils dilate, and that helps you to see better, have better contrast and clarity in that dark room. Now, I guess that they would have to artificially make this pupil size from the colored lens a bit smaller than what your average pupil size would be most of the time. That way your normal color doesn't creep through and show to people looking at you. So as a result, that means you will have a smaller pupil than average most of the time, and that's going to cause you problems in low light situations because with that smaller pupil, your performance and the contrast and clarity that you will see will be less. Now, for all of those of you who are photographers, you know exactly what I mean. If you have a lens that is a large aperture, you'll know that it performs a lot better in low light situations than a lens that is fixed and of a smaller aperture, which performs great in daylight and lots of light, but performs poorly when lighting levels are low. So if you're a photographer out there and you know exactly what I'm talking about, then let me know in the comment section whether you'd be happy with a small fixed aperture for every situation that you find that you have to take photographs in. Now, there are other issues that could be highlighted, but it must also be said and pointed out that there are those lucky individuals that have had this procedure and seem to be getting on fine without any issues at all. However, that doesn't mean that your problems may not arise later on in the future. So that's something to keep in mind as well. Now, at the end of the day, we all have choices, and as long as you are fully informed and you're happy with the risk levels and you think it's worth taking for you, then I must say that the results that these implants give in terms of the cosmetic look is pretty impressive overall. But I do think that our eyes are precious, and they are only precious, however, as long as they continue to work well. So what do you think? Should this procedure be stopped worldwide, or is getting the eye color of your dreams a positive advancement in surgery that we should really all be embracing and trying to improve so that it's safe to use in all countries? So let me know what you guys think in the comment section below. Please hit that subscribe button, notification bell as well. Liking and sharing this video really helps us out as well, so please go ahead and do that, and I look forward to catching you guys in the next video. Take care.